Your doctor has recommended that you have a procedure called an upper GI endoscopy. This brief video from the American Gastroenterological Association will help you prepare for the procedure. I'm Dr. Linda Lee from the Johns Hopkins School of Medicine in Baltimore, Maryland. In the next few minutes, I'm going to guide you through this critical procedure so you understand how an upper GI works and why it's used to help evaluate your medical condition. An upper GI endoscopy is a procedure performed by a well-trained physician who uses the endoscope to diagnose and, in some cases, treat problems of the upper digestive system. The specialist is called a gastroenterologist. Upper GI refers to the upper part of the digestive system. Called the gastrointestinal tract, it includes the esophagus, which carries food from the mouth for digestion, the stomach, and the duodenum, the beginning of the small intestine. The term endoscopy refers to a special technique for looking inside a part of the body using an endoscope. An endoscope is a long, thin, flexible tube with a tiny video camera and light on the end. By adjusting the various controls on the endoscope, the gastroenterologist can safely guide the instrument to carefully examine the inside lining of the upper digestive system. The endoscope provides a high-quality image that gives a clear, detailed view of the examination area displayed on a TV monitor. In many cases, an upper GI endoscopy is a more precise exam than an X-ray. Upper GI endoscopy can be helpful in the evaluation or diagnosis of various problems, including difficult or painful swallowing, pain in the stomach or abdomen, or gastrointestinal bleeding, ulcers, and tumors. An opening in the endoscope can also be used to insert tiny instruments to obtain tissue samples, stop bleeding, dilate or stretch a narrowed area, or to perform other treatments. Regardless of the reason an upper GI endoscopy has been recommended for you, there are important steps you can take to prepare for the procedure. First, be sure to provide a complete list of all the medicines you are taking, including over-the-counter medications and natural supplements. Also, inform your doctor about any allergies you have to drugs or other substances. Your medical team will also want to know if you have heart, lung, or other medical conditions that may need special attention before, during, or after upper GI endoscopy. It's especially important to let them know if you take medicine for a diabetic condition, or if you take anticoagulants, sometimes called blood thinners. You'll be given instructions in advance that will outline what you should and should not do in preparation for the upper GI endoscopy. Be sure to read and follow these instructions. It's very important that you not eat or drink at least 4 hours before your procedure. Be sure to discuss your doctor's recommendations. Any food in your stomach will block the view through the endoscope, and the food could cause you to vomit during the procedure. An upper GI endoscopy can be done in either a hospital or your doctor's office. In either situation, you'll be asked to sign a form verifying that you consent to having the procedure and that you understand what's involved. If there's anything you don't understand, ask a member of your medical team for more information. During the procedure, everything will be done to help you be as comfortable as possible. Your doctor may give you a sedative. The drug will make you relaxed and drowsy, but you'll remain awake enough to cooperate with your physician. The doctor may spray your throat, or you may be asked to gargle with a numbing agent. This will help keep you comfortable as the endoscope is passed. You should feel little to no pain, and it will not interfere with your breathing. And your blood pressure, your pulse, and the oxygen level in your blood will be carefully monitored. Once you are comfortable, a supportive mouthpiece will be placed to help you keep your mouth open during the procedure. Then, your doctor will gently maneuver the endoscope into position. As the endoscope is slowly and carefully inserted, air is introduced through it to help your doctor better see the images. Your physician will use the endoscope to look closely for any problems that may require evaluation, diagnosis, or treatment. In some cases, it may be necessary to take a sample of tissue called a biopsy for later examination under a microscope. This, too, is a painless procedure. In other cases, this endoscope can be used to treat a problem such as active bleeding from an ulcer.
Okay, Mr. Price, we're all finished. You did a wonderful job.
When your endoscopy is completed, you will be cared for in a recovery area until most of the effects of the medication have worn off. At that point, you'll be informed about the results of the procedure and provided any additional information you may need to know. Years of experience have proved that an upper GI endoscopy is a safe procedure, and it only takes 15 to 20 minutes to perform. Complications rarely occur and may include a tear in the intestinal wall, which could require surgical repair. Another complication might be bleeding, but a transfusion is seldom required. Again, these complications are unlikely, but be sure to discuss any specific concerns you may have with your doctor. By the time you're ready to go home, you'll feel more alert. However, you'll need to have a friend or family member take you home, and you should plan on resting for the remainder of the day. Occasionally, minor problems may persist, such as a mild sore throat, bloating, or cramping. These should disappear in 24 hours or less. In a few days, you'll hear from your doctor with additional information, such as results of the biopsy. This is the time to ask any follow-up questions. Remember, upper GI endoscopy is a proven technique. It's safe, reliable, and an effective way to help you maintain your digestive health. To learn more, consult your physician and visit gastro.org.